Artificial Intelligence Dr. www.abcpharma.net/English. User question. Can a unicameral leadless pacemaker enhance physical response despite lack of atrial pacing? GPT-4o answer. Yes. A unicameral leadless pacemaker can enhance physical response despite the lack of atrial pacing. Here's how. 1. Rate-responsive pacing. 1. Activity sensors. Unicameral leadless pacemakers, like the Avir VR, often include activity sensors that detect changes in physical activity levels. 1. These sensors can monitor body movement or accelerations, allowing the pacemaker to adjust the heart rate appropriately in response to increased physical activity. 2. Rate adjustment. The pacemaker can increase the pacing rate during exercise, ensuring that the heart rate rises to meet the increased demand for oxygen and nutrients, thus enhancing exercise capacity and physical response. 2. Compensation for chronotropic incompetence. 1. Chronotropic incompetence. Many patients who receive pacemakers have chronotropic incompetence, meaning their heart rate does not increase adequately during exercise. 1. The pacemaker can compensate for this by providing rate-responsive pacing, which ensures a more appropriate heart rate response during physical activity. 3. Improved ventricular pacing. 1. Enhanced cardiac output. By providing consistent ventricular pacing, the pacemaker can help maintain a more stable and appropriate cardiac output during physical activity. 1. This is particularly beneficial for patients who had a bradycardic or irregular heart rate before implantation. 2. Stabilized heart rhythm. Even without atrial pacing, consistent ventricular pacing can prevent episodes of bradycardia and ensure a more regular and appropriate heart rate, which supports better physical performance. 4. Physiological benefits. 1. Increased blood flow. By ensuring that the heart rate increases appropriately during physical activity, the pacemaker helps maintain adequate blood flow to muscles and organs, which is critical for sustaining exercise and physical exertion. 2. Symptom relief. The pacemaker can relieve symptoms such as fatigue, dizziness, and shortness of breath, which can significantly enhance overall physical response and exercise tolerance. 5. Psychological and confidence boost. 1. Reduced anxiety. Knowing that the pacemaker is there to support heart rate can reduce anxiety and increase confidence during physical activity. 1. This psychological boost can lead to better physical performance and willingness to engage in exercise. Limitations of lack of atrial pacing. While a unicameral leadless pacemaker can significantly improve physical response, there are some limitations due to the lack of atrial pacing. 1. Atrial contribution. Without atrial pacing, the atrial kick, the contribution of atrial contraction to ventricular filling, is absent. 1. This can lead to suboptimal filling of the ventricles, especially during high levels of physical exertion, potentially reducing maximum exercise capacity compared to dual-chamber pacing. 2. AV synchrony. Maintaining atrioventricular AV synchrony is important for optimal cardiac efficiency. 2. A unicameral pacemaker does not address AV synchrony, which might be a limitation in patients who require coordinated atrial and ventricular contractions. Conclusion. A unicameral leadless pacemaker can enhance physical response despite the lack of atrial pacing by providing rate-responsive ventricular pacing, compensating for chronotropic incompetence, stabilizing heart rhythm, and improving overall cardiac output during physical activity. However, it may not be as effective as dual-chamber pacing in patients who require AV synchrony and atrial contribution to ventricular filling. Nonetheless, for many patients, the benefits of improved heart rate control and symptom relief outweigh these limitations, leading to better physical performance and quality of life. Regular follow-ups with a healthcare provider can ensure that the pacemaker settings are optimized for the patient's specific needs and activity levels.